Hello, I'm Mark, and this is the Fast Track Impact podcast for researchers who want to be more productive and achieve real-world impacts from their research. So last week I was thinking with you about how we can evaluate impact from work with media. And this week, I'm very privileged to be spending some time with a couple of colleagues from Swansea University who've been doing something quite special in this arena. So if you happen to have watched the TV programme Casualty in the last couple of months, you might have noticed some maggots in there, and that is down to my colleagues here in Swansea. And I want to explore with them exactly what they're doing to evaluate the impact arising from this engagement. But I'm going to backtrack from there to, well, how do you get your research onto a programme like Casualty? And the broader work that you've been doing to evaluate the impact of your public engagement work. So can I introduce Yamni Nigam, who is a professor of Biomedical Sciences, or she just introduced herself to me just now, a professor of maggots. And I'm sitting here in her office surrounded by papier-mâché maggots, real dried maggots, images of maggots, and many other wonderful, weird and wonderful things. So great. I'm also here with Clare Lehane, who is Impact Support Officer here at Swansea University and has been working very closely with Yamni on this particular element of our impact. So, Yamni, tell me a little bit to start with on how you got into maggots, of all things.
Okay, great, thank you. So I was beginning my lectureship here at Swansea University in 1997, and in this department, which is a department of allied medical health, we teach nurses, paramedics, osteopaths and so on, and the head of the department at the time asked me to develop a module on wounds and wound management. My background was entomology, parasitology and diseases and so on, so I was an insect lover from day one, but when I was doing this I came across something called larval therapy, and of course my ears pricked up. Larvae, they are baby insects, what's going on? And it turned out that maggot therapy was sort of resurging as an intervention, as a clinical intervention in the 80s and the 90s. Now, it had never been here in the UK before then, but it had been widely used in America and Canada in the 30s and 40s, the pre-penicillin era, where anecdotally field surgeons and so on would realise that soldiers would come into their field stations with wounds, bullet wounds, but those wounds were naturally infested with maggots and they were healing. And the soldiers themselves were non-pyrexic, there was no fever, there was no evidence of infection. So as a result of that, some American surgeons decided that they would clinically introduce sterile clinical grade maggots into patients in the 30s and 40s in America, and it worked marvellously. And so we have records of that. But of course, when penicillin came about in the 40s, everybody forgot completely about maggot therapy. Nobody wanted to know it. We used antibiotics for absolutely everything. For a cough, a sneeze, a tickle, it was antibiotics. And of course, now we find ourselves on the cusp of this global catastrophe of antimicrobial resistance. And partly as a result of this, maggot therapy has come back in vogue, not just in Britain and America, but all over the world. And it is out there now as a known clinical intervention for wound treatments, for wound care.
Great. So tell us a little bit about your research on this and how then that has taken you into the NHS, talking to clinicians and trying to overcome some of the barriers that you found there.
Yeah. I started my scientific research and we developed a big team of scientists that were looking at the scientific pathways and the molecules that the maggots were producing that actually had a role in clearing a wound of its dead tissue, of cleansing a wound, of disinfecting it, and what the antibacterial agents were that they were producing, and also the wound healing factors. So laboratory-wise, we discovered over the last 18 years quite a lot of things that the maggots are doing that we've published about scientifically. So we have a really good evidence base of what the maggots can actually do. It's not just sort of a magic thing that's going on. There's a real scientific basis for it. Now, at this time, clinicians, well, in fact, in the UK, certainly, wound care is nurse-led. And so it was nurses, tissue viability nurses and wound nurses that were leading the way of wound management for patients, certainly with patients with chronic wounds. So as a result of my papers coming out, the only company in the UK that produces clinical grade maggots based in Bridgend in Wales got in touch with me to say, we would like to pay the university to have you go and speak about the science that you found. And obviously it's not just our group in Swansea, there are other groups across the world that are researching this, and they wanted me to present all that work sort of to clinicians. So 2012 was my first presentation in Edinburgh, and it was to a room full of nurses who were aware of maggot therapy but not aware completely of how it worked and how they worked so effectively to debride wounds and to clear wounds. So, and from then on, it just escalated and escalated. And I was being invited out to speak all over Europe, really, to clinicians who would immediately then think, right, okay, this is the sound basis. It's not just scientific. We had a clinical evidence base. We'd had RCTs that were being done, and they would then be made totally aware of the extreme efficiency and efficacy and exactly how maggots were doing what they do in wounds. And the fact that a 4-day treatment with maggots could turn a wound that had been stagnant for 18 months on its head within such a short period of time. And they were presented with this information, and they were just right, okay, this is beneficial. So evaluating those sessions proved to be really, really useful, because you realise straight away that they were going. In fact, in one session in Copenhagen, there were doctors and nurses present there, because there are many doctors, vascular surgeons and so on, that look after wounds in Europe. They said to me that we had a chat at lunchtime about patients that we knew that we immediately felt now they could benefit from maggot therapy, and we went away and administered it and put it on. So you realise straight away that that's awesome, that's great, that's having an impact straight away.
Amazing. It's the power of highly rigorous research to convince people there is an evidence base, and not just it works, but this is how it works. We understand how this works. And actually, for a bunch of clinicians, well, great, that works. We do evidence-based medicine. Here's the evidence. Let's do the medicine. Fantastic. What about your journey then with the patients? So you led a number of interventions with patients to try and see if you could change attitudes towards maggots amongst patients. And I think this is then the precursor to what you're currently doing with the programme Casualty. So tell us a bit about that.
Yeah, indeed. So I one thing that struck me a while ago was that the clinicians that I would talk to and who would say, yeah, no, it's great. We now know that maggots are absolutely brilliant. The problem is that even though the therapy is out there, it's on the NHS as an NHS prescription here in the UK, it was just something that the uptake was low. And what hit home was when I was applying for grants to carry on with my science, and one referee's comment said, that's all very well, the science is sound, but nobody wants to use maggots. And that made me think, is that really what's happening? So we launched, the first part of this project was a massive survey that we did with 500 people almost online, to find out, is that true? Is there a yuck factor? Do people find maggot therapy, the idea of it, disgusting? Would they not have it if they were offered it? And of course our results did show that yes, that was very much the case, and we had a huge problem on our hands, and many people would not consider having maggot therapy. So that's when I thought, right, I think we need, first of all, the awareness was very poor. I think in all the work that we've done, we found roughly around 40 to 50% awareness in the general population of adults who are aware that maggots can be used as a treatment, or indeed are being used as a treatment. So that was one thing that I thought, right, that needs to be addressed. And if public engagement of our work, Love a Maggot campaign, was set up in 2016 to try and take that on, and to see if we could raise awareness of this really brilliant wound intervention, and two, to see if we could look at the disgust aspect, and if we could change the dislike or change the inherent negative perception that people have of all sorts of squiggly things, but maggots in particular, because they associate them with decay and rubbish and things. And we needed to emphasize that what we're talking about are medicinal maggots. They're one species, a special species that we rear clinically, so they're sterile, they're clinical grade. They're not the ones that you find crawling on a dead rat or whatever, or from sewage. They are really, they're quite different. And this is how they work. And I think taking that out to people, and it's amazing, you actually see it happening at my Love and Maggot engagement events with the team Maggot. We tend to get people going, no, I'm not coming near you. I don't want to look at your maggot stand. And then they're drawn to it. And by the time we've talked to them about the life cycle, about what maggots do, about the fact that we put baby maggots on wounds and within 4 days they can turn that wound around, they're like, wow. And we have a station called Feel How Maggots Feel, where we actually invite them to have a handful of maggots, clinical grade maggots, and reluctantly, but they do it. And then they're like, well, yeah, actually, this is fine. I could have maggots on if I needed to. And so that, and evaluating all that, has been key to our taking our research out to the public.
Brilliant. I've seen some of the stats, and it is impressive how the before and after you are turning people's opinions around. But the problem for this is that there's only one of you. You can do stuff at public engagement events. You can have a stall, but the scale of the challenge is it's global. You've set your sights on the UK, but how then do you get that message out at a much broader scale? So tell me, what were the steps that led to getting onto Casualty?
Okay, yes. The paramedics, the College of Paramedics, invited me to give a talk on burns wounds in particular and the role of maggot therapy. So it was, as I was doing that, a talk, a paramedic was sitting in the audience who actually moonlights as a consultant for Casualty. And he approached me afterwards and said, this is great. I'm one of the people that Casualty refer to when we're talking about paramedic storylines and cases and so on. Would you like me to talk to them about having a maggot storyline, because it would be awesome? So I said, yes, please do. This was Tom Hughes, a colleague here. So he mentioned it in passing to somebody, and they seized it and invited me in August 2018 to give a maggot talk about all the science and about everything that we're doing, about our research, to a group of producers and script writers in the studios in Cardiff, which I did, and still didn't know whether they'd bite or whether they'd buy into it. And fortunately for us, they did. And not only did they bite into putting maggots in on one episode, which is what we thought they would do, they've put it in through a storyline in 4 different episodes, which we were so thrilled about. So that started. They obviously started to write the scripts. They'd send the scripts to me. I would read them, and we would then change what we thought was. Obviously they needed accuracy, so they wanted to know about fly life cycles. All this was in fact incorporated into the episodes. So there was a lot of research a lot of contribution that we made, that I made here, in terms of helping with script writing and so on. And it was just brilliant. It was just such an enjoyable experience as well. I did try and, in fact, one of the scenes, which hopefully people will see, a lady has maggots put on a burns wound, and she's absolutely in love with the whole idea of maggots because she's into nature and all these things. And she says to the consultant, "Oh, are you in love with maggots because they are natural and beautiful?" And he says, "No, I'm in love with them because of the science." And I just thought that is superb, because we've got our research in as well, which was great.
I love it. It's so exciting. I think the lesson here, more generically, is it's about being in the right place at the right time. And so you may be listening to this and thinking, well, isn't that good luck? And I would argue this is not luck, because, Yamni, you have worked those networks. You have made the time to go and talk to the paramedics, the nurses, etc. You are out there, and it's because you are out there mixing in those circles that you significantly increase the likelihood that supposedly chance meeting actually happens, and it happens to you, and you get that opportunity. So I think just being out there at the right place, in the right place at the right time, is hugely important. You can, of course, if you want to try and do this more on purpose, and I know a number of people who cultivate relationships with producers and identify people like this, and so that is an option if you want to. But for you, this is something that you embraced, because certainly when I was talking to you a few months prior to this, you were asking the question, right, so how now do I take this national? And so often when you put that kind of message out to the world, you're there waiting, ready. When the opportunity comes, great, you spot it, you jump on it, and that's what you've done. So give us a little bit of a sense of how the science is being put across in these programs, and the extent to which you had pushback from the producers. Well, wouldn't that be nice? But actually, yeah, it's a bit too complicated. Or to what extent did you have to compromise? What was that whole process like in terms of working with the writers and the producers?
That's a really good point, because we, again, I strove for accuracy. Being a scientist, I really wanted to make sure that everything that they said was going to be completely accurate and not misleading in any way. But of course, what we had to marry up with the fact was that they are a medical drama. Casualty, they're not. Then it doesn't matter to them really whether they're not making a documentary on maggots. So accuracy for them wasn't a big thing. So when they suggested certain things, like the house fly, they wanted to call it, and I had to be quite strict and say, no, this is a green bottle fly. You have to change that. And so there were certain things that you wanted them to be quite clear about. And I did. I made every change that I felt I wanted to make. I did. Having said that, I had to bear in mind that it was entertainment, and if they are going to have a scene where a lady who has maggots is going to stand on the maggots by accident and squish them to death, and even though I really didn't like that, it has to happen because it is entertainment at the end of the day. So I found that a little bit tricky, but I was so thrilled that they were still, they were going with it, and a Casualty has an average audience of 4.5 million. So you can imagine the fact that you are now talking about a maggot therapy to the public, who many of whom wouldn't have known about it, because our pre-stats questionnaire tells us that it was about a 45% awareness in the population that watched Casualty that knew about maggots. So hopefully we've turned that, and we've made that 100% awareness in those people. But also, of course, we've done other things like look at whether it's changed their opinions on maggots, or their perception of the therapy, or the acceptance of the therapy. But we haven't got that data yet, but we're hoping to get it.
Great, because I think some people feel quite nervous about engaging with the media, but especially an entertainment program like this, that actually I'm going to lose control, they're going to misrepresent the science, and this is now going to be my name on the credits, and that is quite a worry for people. So I think it's quite reassuring just to hear, well, yeah, you've made some compromises, but actually the red lines that you drew, you were able to keep those red lines. So finally, I want to just have a think about how you're evaluating this. And I'm not sure if you want to maybe start, but also I'd like to bring in Clare on this. And so you talked briefly there about a pre-survey of the population of people who watch Casualty and some stats you've got there. So I'd like to learn a little bit more about the methods that you're using. But Yamni, if I can start with you, and then if you want to hand over to Clare, just tell us a little bit about the role that Clare has played in supporting this impact.
Yes, I have to say that this whole notion of impact and impact case studies and so on is quite a foreign one to a scientist who's working all her life in laboratories and looking experimentally. But I've embraced it wholeheartedly, because I absolutely think it's so relevant and so brilliant to be able to take what we've spent many years looking at out to people that matter, to people who might benefit from all the work that we've done, the research that we've done, and the knowledge that we've accrued. So I was completely, I really needed support in this, and I think that many academics have strengths, but not all of them have a strength where they can they can suddenly turn everything they do and make it impactful. And I think that's where people like Clare Clare have been completely key and pivotal to all of this. And Clare can tell you more. But without Clare, I would never have been able to do as much of the impact, including the public engagement. She is awesome at public engagement. She will speak about the life cycle of maggots with such a wonderful passion and in an engaging way. But more than that, it's the support of the understanding exactly what impact is and how to evaluate it and how to evidence it, which Clare has been critical in supporting me with. So I'll hand over to her now so she can tell us a bit more about the process.
Thanks, Yamni. Well, I came into Swansea University 2 years ago from a non-impact background. So I've been learning for the past 2 years as well, alongside Yamni. And I became part of the Love It Maggot team really early on. She needed someone to talk about the life cycle. And I was like, right, I have a background in zoology. I can do this. So we did it and then became part of the team. And so doing the public engagement, going out to schools and going out to other types of clubs, that's really enjoyable. And you get to see people learning that maggot is part of the life cycle of a fly. And some people don't get that. And I get to show people a gory leg with different types of wounds. And that gets people interested in, this could happen to them or this could happen to their family or friends. And this is a viable treatment that you could talk about with your GP or your nurse or your clinician. So that's one part I really enjoy, talking about flies and maggots. This is great. And then the other side is the evidencing the change. What is this actually doing for real people in the real world, outside of papers and academia. And for this Casualty, it was such a big opportunity, and we were able to potentially reach a very wide group of people that we would never be able to reach through any other means. Of course, we were like, okay, how do we talk to these people? How do we find out what they really think about maggots before and afterwards? And we talked about, the best ways to get that information. And the easiest way for us, because of the demographics and the widespread of Casualty, was through a pre and post survey. And then it was kind of looking around to see which would be the best provider to do that. And we found a company that could do that on our behalf, and they were very efficient and much more efficient that we can do it. And so we're now waiting. We did the questions and we went through it with them, and we went through it together as a team. And we're now waiting for the feedback. But really, my role is to support and help Yamni and anybody else in the college who wants to do something around impact, just to have a think about this so what question. How do you want to go? What do you want to get out of this? Who do you want to help out of this? What is your question that you want to answer? And sometimes just talking about those questions outside of an academic environment is really useful for me, because then I get to see what everybody else is doing and how I can slip into their workflows.
Yeah, great guiding questions. Who do you want to help? What is the benefit that you want to see? And then designing your evaluation around that. And so in this case, we've got a before and after. Tell us a little bit about how you chose the company. I'm not sure if you can tell us which company you chose, but how did you choose? How should people go about, I want to commission some kind of survey that will give me a cross section of the UK public in this kind of way. So how do you go about choosing a company like that? And what was the process like working with them? To what extent did they help you design the questions, or was that entirely up to you? Tell us a bit more.
Sure. So basically, we wanted to work with a company who had a track record with working with TV surveys. So we basically did a very big Google search and tried to find companies that had a track record in this. And we brought it down to 3 or 4 companies. And then I went through their websites and rang them up and say, can you give me examples of where you would have done something similar in another case? And, there was other more pedestrian things we had to look into, like the cost of it and, how soon could they do this, because we're operating quite a tight timeline. And we settled with this one company who did have a background of doing TV surveys. It was their bread and butter. And they, we Skyped them. We talked about the things that we were hoping to get as a result of the Casualty episodes. They went away and they came back with a draft idea of what they could do. Yamni signed off on it, and then we start working with them on the types of questions we would like to ask. So it was quite iterative. I would send a group of questions on behalf of the team, and they would come back and say, yes, we can ask that question, or this question doesn't make sense in a pre-survey, it might be better in post-survey. So they were quite good in kind of directing us down the official survey lines, which we had never done before, but still allowing us to ask the questions that we needed to ask to get the kind of answers that we were hoping that would be thrown back by the survey. So it was mostly kind of, because we'd never done this before, it was a lot of kind of Google searching and talking to people and getting on the phone and asking people what they had done in the past. So yeah.
Great. So you don't have the results of this yet, and I'm not sure when this will be publicly available. At the latest in 2021, as part of a Ref Impact case study, we will all get to find out what the results of this are. But maybe you can give me a sneaky update on the general trend, and I can update people on that at that point. But at this point, tell me what are at least one or maybe two of the questions that you're most excited to hear the answer to. So give us a sense of the kind of answers that you're expecting to get.
Well, the main things that we would like to get out, that Yamni would like to get out of this survey, is to see that there is an increased awareness of maggot therapy as a therapy on the NHS, and also that there is some shift or change in people's perceptions about maggot therapy. What that shift and change is, we don't know yet, but we would like to be able to see, after watching these 4 episodes, that people are more aware of maggot therapy. Whether they're more aware in a negative or positive way, we don't know yet. We hope positive. But those are the 2 main questions that we are interested in. And if they would ask by themselves for maggot therapy if they had a wound that was suitable, because obviously people go into the clinics and the clinicians give them a range of options for wound healing, and if the clinician hasn't mentioned maggot therapy, maybe a patient would then say, oh, what about maggot therapy? And then that gets the conversation started about maggot therapy and gets into the clinician's mind and the patient mind and the nurse minds again. So those are the kind of things we're not sure that we can glean from the survey answers, but how interesting would it be if we could?
Yeah, we shall find out with bated breath. Amazing. So we're coming to the end, and to conclude, I'm going to give you both a chance to say a couple of final things here. But for me, the thing that inspires me about the story that I've heard is the enthusiasm that you've brought to this right from the outset. So I met you about a year ago when I was here doing some training, and instantly that came across to me. And listening to your story, one of the things I love about this is how this is you being innately fascinated by your research and following your nose because you're just simply curious. So, maggot therapy, does that actually work? And if it does, then how on earth does this work? What's the process? What's going on here? And from there, then applying that same curiosity from your research into your impact. Well, what would happen if I work with this company? And what would happen if I started talking to clinicians? Could I change their mind? And with publics. And I think what's unique about the way you've managed your public engagement is the way that you have applied that curiosity throughout your engagement work, always asking the question. So where are you at the beginning? Where are you at the end? Has this changed? And actually researching your engagement as you've gone, which has been invaluable in terms of building evidence to support the claims that you now want to be able to make about the impact that you've had. So I think the message for me that comes out of this is that you can follow your passion in terms of the curiosity-driven research. You can apply that curiosity to your impact, and by being curious and enthusiastic, you go down routes, paths, roads you would never have dreamt of going down, and actually they are innately fascinating and inspiring. So to conclude, I'd be interested to just get some perspectives from you on what people can do. They're sitting there listening to this thinking, yeah, I would like to engage more with the public. I'd like to engage more with media. What are the key things that you need to do to make this work? And what would you say to people who are still feeling a bit nervous about this?
Yeah, indeed. And I think a lot of people do feel very nervous about engaging with strangers, with the public in many scenarios. So I would literally say that, as having spent the last 20 odd years as a researcher and having had my work continually being talked about and evaluated by academic peers or by people at conferences and referees and so on, it was absolutely refreshing and amazing to take what I understood to be what I'd done in a completely different way and explain it in a very to lay people, to the public. It was just a wonderful thing to do and extremely valuable for me to get feedback and to chat to people who wanted to know about the work in a completely different way to the way that I had to speak about it before and in conferences. So that I would encourage anybody and everybody to, if they are in a position to go via some outreach program or an engagement, if they have an engagement outlet, to do that and really just see what you make of it, because it is just such an enlightening and wonderful experience. It really is.
Yeah, and I would just echo what Yamni said. I mean, the bar to entry to public engagement is not having episodes on, a UK-wide show. There's a lot of professional societies out there that have public engagement awards that you can apply for and do maybe a couple of classes in a school nearby and just see how that works for you. A lot of universities have initiatives like Reaching Wider that you can go and talk to and say, I'm interested in talking about microbes to 7-year-olds. Would there be a school that would be interested in doing that? And they can work with you. A lot of universities, like Swansea University, have public engagement forums that you can go talk to and say, what's my best route into public engagement in schools or in other clubs? So I guess while public engagement can feel very big, you don't have to start big. You can just start small. But the question is, why do you want to do it? And what is the point of you doing it? What do you want to get out? And what do the people that you are talking to get from this? And then you can build, as Yamni has done through years and years of hard work.
But absolutely worth it. So we should do our bit for maggots here. And if you yourself have not heard of this before and you're thinking, this is a thing, and you're maybe even changing your own mind about maggots, and you want to find out more, then the website, Yamni?
Yes, we've got a website which has got absolutely anything and everything you ever wanted to know about maggots and maggot therapy, and the website is loveamaggot.com. That's great.
Wonderful. Clare, Yamni, thank you very much for your time. It's been a real pleasure. Looking forward to finding out how this unfolds.